cocktails, I really have a very, very short set of thoughts. First is just to invite everyone to stand up and stretch a little bit because we've been sitting a long time. So let's do that and get some energy going. Wanted to just a huge shout out to Jill. I'm sure everyone appreciates it, but just a little bit of history. So I think truly, I watch Einar walk off the stage, that one of the things that's happening in this digital health environment is there really is a community that's being built. And it's a community among all of the people that are involved in one dimension or another. And as you come back to these meetings, you just begin to see it, you begin to build. We were commenting that the people that have signed up for this particular set of meetings include a number of new folks, an increasing set of participation from the pharmaceutical communities, as I think we've heard. Almost every major pharmaceutical company now has something happening in digital health. The tech companies, we've heard Cisco, we've heard Intel, Qualcomm just announced another project that they're doing in diabetes. So the list goes on and on and on. And so that really allows me to say two things. One, there have been over the last, since I'm kind of calling the inception of the ecosystem, which is give or take 10 years ago, there was an immense proliferation of these kinds of meetings. And one of the voices that I've had in the various opportunities is let's do more consolidating, let's do more bringing together, let's not spread so many meetings around and so on and so forth. So one of the things that this represents is bringing Jill and her Digital Health Summer Summit together with the bio represents one of those movements to essentially continue to forge collaboration. So Jill was terrific in saying, yes, of course, let's bring the bio together with the Digital Health Summit since they were both going to be in San Francisco. This is my third year from the bio perspective, serving as chairman of the Digital Health track. We did it for the first time 2 years ago in San Diego. We had standing room only crowds for many of the programs that we had put on. We then went to Philadelphia last year. We were very excited to be in San Francisco this year, and then we'll be in San Diego next year. So the notion of getting some momentum to watch the stories continue to unfold, which then allows me to close just to talk a little bit about what tomorrow portends. First, as you've heard, each and every one of you, by definition, in signing up for this couple of days, are invited and welcome to the programming that's set up for tomorrow and Thursday. So that's first and obvious. We're inviting everyone to the Digital Health Zone for a meetup after this. If you haven't been by to see what's going on, we'd love to make sure that you have done that. And then what we're really trying to do tomorrow is do the best of showcasing Silicon Valley meets digital health meets the world, and maybe not just even Silicon Valley, but one step broader, California. So we're going to open with Leslie Saxon, who is someone who, again, I really put at ground zero with the digital health movement. She at USC is a world-renowned cardiologist, and so she's in the clinic working with her cardiology patients, on a daily and weekly basis. But from that position of insight, starting about 10 years ago, she started the USC Center for Body Computing. What was very unique about that particular activity, and we'll hear more tomorrow, is that she used not only all that was happening in medicine and the like, but she used some of the USC's capabilities in and around cinematography and used those tools to move into a lot of the virtual reality and augmented reality. So we'll see her kick off tomorrow with a lot of the extension notions that you're not ultimately going to have to be in a hospital or in bricks and mortar to experience a great relationship with your healthcare provider. We're then going to talk about social media and how that interacts with what's happening in digital health. And some folks from Facebook and others are going to be on that path. Again, a visitation to aging and really extending some of the conversation today. I'm going to lead tomorrow afternoon a deeper conversation in and around what's really happening in the investment community with a couple of our prolific investor representatives. And then a full day of more pharma and kind of bio as a sort of institution, if you will, meets digital health, and a day of programming on Thursday. So that said, let's thank Jill once again. Thanks to all of you for hanging in here. It's been a long day, and we'll hope to see you with a glass of wine or something in your hand shortly. But thank you again. Take care.